Hi all. So in today's class, we are going to start with obesity and underweight under nutrition and dietetics domain. So when it comes to obesity and underweight, so the most probably when a person at most first time when they plan to follow any sort of a diet chart or anything like they wanted to go the modification in the lifestyle or maybe the food habits that they go with, the first priority or the first cause of it would be because of overweight or because of underweight. Okay, so these are the major more two extremities where the people will go with the choice of diet management. So when it comes to diet management, everybody have a myth. What does it mean is like we have to sacrifice something in our life. It's not like that. So we can consume whatever we like with a proper proportion or for proper balance. So that is what is a major criteria when we go with the diet plan in regards to obesity, in regards to underweight. So let us start with the science behind it and let us go with a further discussion. So when it comes to obesity, so according to the World Health Organization, what is obesity? So obesity is basically like excess fat accumulation that has been taking place and that is leading to the risk of health. Okay, so fat accumulation is being too much. So accumulation is like something is stored and fat has been stored into your body, and where does it lead to the risk of the health. And other than that, when it comes to obesity, what are the other factors that has been caused? One is chronic disease, and other is going to be like chronic disease is due to because of like social factors, behavior, psychological, metabolic, and molecular, and all those things. And when this comes, the desire is to like when it comes to the obesity, satiety, choice of food plays a very important role, and digestibility plays a very important role, and also absorption and metabolism. So when all these factors are being hindered, like when we go with satiety is fullness. So when you don't feel full after having good amount of a meal, it means that you didn't have a complete proportion of all the nutrients in a balanced way. Okay, you feel like eating snacks or eating something even after having an heavy lunch, immediately you feel hungry. So because you didn't cover up the nutrients that is required for your body. And digestibility, maybe they would have there will be a process where the digestibility would have been hindered, and because of that they would have pooped. Okay, so that may be the cause. And then absorption may be disrupted, there won't be a proper absorption. Because of that there would be a deficiency that be causing up, and absorption is hindered, and that will be converted into fat and stored into the body. So that will be happening. And then obviously the metabolism is all about like biochemical reactions that is taking place. You people would have heard certain cycles like gluconeogenesis, and you would have heard about the glycolysis and Krebs cycle. And all this are very important cycle or very important process that plays metabolism that helps you to break down the nutrients into the simpler compounds and to provide energy and required functions. Okay, so these are the certain very important factors, or a definition we call it as when it comes to obesity. And then we are going to go with etiology, like it's going to be the causes. What is the reason? Okay, first is genetic factors. So genetic factors is most probably like 50 to 70% of people, they do have a chance of becoming more obese because of genetic. Many people you would have seen like I'm obese because of my genetic. My ancestors, my father are obese, so that's why I'm obese. Obese plays a very important role, like it plays around 50 to 70% of chances in like what to say in becoming fat. Okay, so most like families of chance of 80% of both parents, if both parents are obese, 80% of chance of becoming obese. If one parent is obese, 50% of person is behaving obese. So the percentage differs, one parent with two parent. Okay, age and sex. And um what to say it, age and sex doesn't more interfere in underweight, in obesity category. Okay, so it's completely based on a positive energy balance. What is positive energy balance? The amount of calories that you intake, the amount of calories that you expel out. Okay, that you spend as an energy, it has to be equal. If the intake is too much and spending of energy is completely less, it is not a positive energy balance, it is a negative energy balance, right? In same way, you are spending so much of energy and you're consuming very less of energy, it is going to be the negative energy balance. Okay, so this is how you people have to balance with obesity. Yes, and when it comes to the studies that has been conducted by Nutrition Foundation of India, so it's shown like females than males are found to be weight among all age groups. So when you see male and when you compare female, female is found to be um, gaining weight than male. So that may be the based on sex differences, and that is why, because of an hormonal balances or hormonal changes that has been happening among ladies, right? So yes, next etiology is going to be the eating habits. So eating habits, most probably people have an habit of having meals in between, like housewife, whenever they cook, they keep on munching something and they cook, so the in order to, what to say, taste the recipe. Tasting a recipe, it turns out to be so good, and we keep on munching, and we ourselves will, what to say, um, we ourselves will get over all the things that has to be served out, we ourselves will consume it by cooking only. So those things will be happening. And eating faster and taking less time for chewing. Okay, so that plays a very important role when it comes to obesity. So some, you would have seen some people, like they will eat in a minute and they won't chew the food. We have to chew the food and break the food into the simpler components in order to make it absorb. Okay, and like, and also the neurotransmitters, okay, and the chemicals, that plays a very important stimuli to cut down you and stop you to having food more than the limits. If that is not working out, that is also one of the major cue for weight gain. And also housewives who are found cooking variety of foods, or persons who are working in kitchens, may become obese. Okay, so that is also one thing. And business executives who do attend more frequent business lunches, that is also the major reason. And housewife who consume more and more of leftover meals, and people who eat too much outside, and people who does not consume more amount of fruits, and eating more of processed foods, and they are having a more and more of, what to say, stress eating, because of uncomfortable experiences, and all those things. And also along with that, the body clock, if the body clock is not adapting according to our situation, that also plays. Body clock is like we are tuned something, at this time I'll have a breakfast, at this time I'll have lunch. If that is not working out and that is changed, that might lead to obesity. Okay, so these are the certain factors that leads to obesity when it comes to eating habits. Next is physical activity. Obviously, obesity is found most probably in the people who are sedentary. Sedentary means the people who is sitting for 24 bar by 7, and they don't go out, they don't walk, and they don't, what to say, spend energy much by the physical activity, by walking, jogging, running, or something like that. Okay, so those plays a very important role. So it's very important for a person to walk at least 45 minutes. I saw the recent study that came up, where jogging for 45 minutes will help them to keep away from any chronic disorders and obesity. Yes, recent studies which I saw. So physical activity plays a very important role at the any choice when it comes to obesity. And then stress. Okay, when a person is too much of stress, and food is one of many stimulants when it comes to endorphin, feel good neurotransmitters. And that is like self gratification, depression, and all those things. Okay, so when these things are happening, it's very important we have to take care of stress as a major contributor when it comes to obesity. Next is going to be endocrine factor. Endocrine factor is like, most probably when it comes to hypothyroidism, hypogonadism, and Cushing's syndrome, we could find obesity very normally among these people. And puberty, pregnancy, menopause, and during those time we could find obesity in general. So endocrine factors are being contributed for all this, right? So yes, then trauma. like certain damage in hypothalamus, head injury, and because of that, that might lead to obesity. And if that head injury happens, there is no regulation of appetite and satiety, right? So because of that, obesity would have been the major cause. And then prosperity and civilization. Yes, obesity is common among countries like UK, USA, and all these things because of higher socioeconomic status. And they have good purchasing power and availability of surplus food soon. Because of that, they are obese. And obesity is very rare in primitive societies like wild animal. Civilization plays a very important role in supplying and appetizing foods and concentrated foods and variety of foods in market. So yes, so these are the certain factors when it comes to obesity, like etiology. And next we are going to see about the assessment. In what way we can assess the weight, in what way we can judge them. Okay, first is going to be the body weight. So an adult weighing 10% more than standard weight will be overweight. Okay, so we know body mass index, okay, BMI. So body mass index is accepted worldwide as an better estimate of a body estimation, okay, fat estimation. So BMI formula: weight in kg by height in meter square. So we have certain grades like not obese, that is like not obese is lesser than 25, which is underweight, and which we are going to see it in a while. And then grade 1 is going to be 25 to 29, and grade 2 is going to be 30 to 40, and grade 3 is going to be greater than 40. And those things are major assessment. And then waist circumference, more practical tool by the clinician. So most probably waist circumference is helping you to evaluate the patient's abdominal fat, and we could able to work on it specifically if they have so much of fat that has been accumulated in abdominal. And we could find that the abdominal fat is more normal in people around. So whenever when we go with waist circumference, clinic the clinical people will most probably go with this assessment. So men is greater than 40 women. So most probably women will start accumulating more and more of abdominal fat and lower body fat. That happens. And then ponderal index is ratio between like ratio of height to the cube root of weight. So that is the thing. And then waist ratio and hip ratio we have to calculate. And waist by hip is equal to 7.0. Okay, that is the formula. And Broca's index is going to be height in centimeter minus 100. So that will help you to go with ideal body weight. Okay. And then there are certain obesities like type 1, type 2. So grade 1 obesity is going to be like more than 25 but lesser than 29.9. Okay, so which is not more dangerous, where we can make them to come under control. Okay, type 2 is going to be like 30 to 39, and which is very important, where the person has to go and check with this blood glucose level, his hypertension level, and all these things if they have any chronic disorders. And during this case we have to go with the treatment with chronic disorders along with an obesity. So based on that we have to plan a diet plan. And grade 3 is going to be above 40, very pathetic, and they have to go with any sort of proper diet and physical activity, where after maybe the duration of 12 months, or maybe the duration of maybe 16 months, we could see that the weight is getting reduced. And they have to go with a proper diet plan, and no, what to say, no quirky diet plans to be followed. So we have to be very careful in that. And then next is going to be like when it comes to all these types, we have certain distribution of adipose tissue, which is like apple versus pear. When it comes to apple is going to be above the, or to say, apple is going to be above the waist and pear is going to be below the waist. Okay, so most probably pear shaped is woman and apple shaped is men, which is very normal, we know. So next, we are going to go with the treatment. When it comes to treatment of obesity, first we have to go with the diet therapy. So what is diet therapy? When it comes to diet therapy, it's very important, like in what are the formats we have to go with the diet plan. So first, it's going to be very low calorie diet, which is lesser than 800 kilocalories. That will help you to go with a rapid weight reduction. And it doesn't mean that you will feel so, what to say, so hungry and that will not fulfill my requirement. So during this low calorie diet, what the dietitian generally prescribe is they will go with high fiber. So when the fiber is more, you will feel more satiety and you will not feel to have something on and off. So when we are being given a diet plan, most probably dietitians will split up into the very small frequent meals. Maybe it will not go with the three, it will go with four and five frequent meals that will help you to cover up the requirement. Okay, so you will not munch every single time. Next, diet therapy is going to be probably it's physical exercise. And when it comes to diet therapy, very important factors to be noted down is macro and micronutrients. So when it comes to energy, the energy output has to be equal, that is like positive energy balance has to be followed when it comes to the weight loss diet plan. So it's better that we go with 20 kilocalories per ideal weight. So we will be calculating ideal weight. Ideal weight we saw in Broca's index, right? So when you are calculating the ideal weight, we have to go with 20 kilocalories per kg. Like for example, if ideal weight is let me go with 68, they have to go with 20 kilocalories per weight. So 68 into 20 will be the calculation that will be happening. So that is the very important factor. Protein has to be with around 0.8 to 1 grams of protein. And carbohydrates, it's better that they avoid all this potatoes, rice, and all the sugars to be avoided completely. And fruits that is completely rich in carbohydrates like banana has to be avoided when it comes to weight loss. It doesn't mean that they have to avoid it completely. Maybe the proportion or the portion size has to be reduced. Okay, yes. And carbohydrates, high carbohydrate food contents like has to be like, as I told you, like potatoes and all these things. Then fat is what to say, we have to go with like based on the requirement. It doesn't mean that when it comes to weight loss we have to avoid fat completely. No, we do have good fat and bad fat, LDL and HDL. We have to take care of all those things. Okay, so we have to be very careful when it comes to the fat restrictions. And then vitamins, we have to go with the proper vitamin supplementation. And it has to be consumed through food. And if it is required, your food is not fulfilling your vitamin requirement, we can go with supplements, just in case if the doctors are suggesting you. If not, no. If not so, you must not proceed with any sort of a supplements until and unless it is required urgently. Okay, yes. So those things has to be taken care. And when it comes to diet for obesity, if in case you people are restricting fat from your body, you people can't go with fat soluble diets, right? Vitamin A, D, E, and K fat soluble diets. You can't expect your body to absorb fat soluble diets. If that is a situation, you can go with supplementation. Yes, minerals. So restriction of sodium is very common. And taking restriction of sodium is like very common. So and that will help you to reduce the retention of fluid in the body. So that is the more important thing. And calcium rich diet that include dairy resources plays a very important role in keeping human in check of weight. Okay, so calcium rich diet will contribute for your weight management. And then fluid has to be taken liberally. And usually extra fluids will be excreted through urination. So that is fine. So have good amount of water. And high fiber, as I told you when I started about the diet therapy, the first thing that I mentioned you is fiber content has to be go in and well when it comes to the diet plan for the obesity and for diabetes. Okay, high fiber low calorie foods like green leafy vegetables, fruits, vegetable salads are highly prescribable when it comes to um, obesity diet plan. And we can go with cereals and pulses, which is also rich in protein. So yes, that will help you to manage your weight. And then glycemic index. So glycemic index is like, that is almost a contributor of carbohydrate. Glycemic index will help you to spike your glucose level. So it's better when we go with the weight loss and obesity reduction, we have to go with low glycemic index foods. Okay, but that will help you to promote the satiety, and that will help you to promote the fat oxidation and expense of carbohydrate oxidation. Yes. And other methods when it comes to the weight loss, we can go with like a physical exercise. So what is physical exercise? What can we do? We can go with walking for at least 45 minutes. We can go with jogging for at least 45 minutes. We can go for cardio, and these are the basic exercises where we can push for us to go with physical management. And stress management is very important. You can practice yoga. Yes, you can go with, if it is required, you can go with any sort of a therapy that is needed. And pharmacotherapy is in sort of what to say, the surgery that will be held up to remove the fat from the body. And behavior therapy, like you are more stressed and you're more anxious, and that might gain you weight, and those things has to be rectified when it comes to the therapy. And certain surgeries which can be also followed up. And next, the complications when it comes to obesity is physical disability. You will not be like when you were lean. You will feel very uncomfortable. You can't walk frequently, you can't climb stairs frequently, you will feel more tired and fatigue.